Okay, well, if everyone's ready to go, we might kick off. Excellent. Well, thank you for attending our seminar this morning. I'd just like to begin by acknowledging that I'm on the lands of the Kaurna people today. Pay my respect to Kaurna elders past and present, and I extend that respect to the traditional owners of the lands wherever you might be calling in from or watching this recording from today. And acknowledge that this always was and always will be Aboriginal land. It's land that was never ceded. Welcome everybody today. I think we might have a little bit of a post-long weekend effect happening, that we've got some low numbers calling in today, but that's okay because we are recording. So for those attending, please be aware that you're being recorded. And we'll promote the link to this recording post the seminar so that you can share it with your colleagues. We approached the Commonwealth Department of Health and Aged Care about doing a presentation today because we started to get some conversations in some of our network meetings around accessing aged care for our clients, particularly for clients who may be using drugs or alcohol or having difficulty with drugs or alcohol. And people started to express a couple of experiences. One, that they experienced quite a bit of sort of stigma and discrimination when trying to get their clients into services, but sort of overwhelmingly that people didn't really understand the aged care system. We've had some really good gains in the drug and alcohol sector, particularly in terms of harm reduction, which means our clients are living longer, living healthier lives, and really kind of that need for aged care services is increasing. So we thought it would be great to get some people who know the system, work in the system, provide parts of the system to talk to you about navigation today and about navigating those services and sort of where to go when you want extra information on how to help your clients access aged care when they need it. So without further ado, I'll introduce David Fraser, Anthony Cameron from the department to talk through some of the system. And then we're going to hear from Carmilla from Anglicare, who is one of the care finders for our system. And she's going to talk about what Anglicare do specifically and sort of how to access help. So I will pass over to David and or Anthony, whoever's going to talk first. Thank you.
Thanks, Sam. So I'm David and there's Anthony in the corner there. We're from the South Australian State Office, Department of Health and Aged Care. And as Sam said, we'll take you through the navigation of aged care, how to access it from there. We'll go through the types of aged care services to start with. We'll take you through that process now.
And I'd just like to say that, it's hard enough for vulnerable people to access any services. And it's difficult for everyone at the moment to access aged care services. But what we don't is we want to make sure that for you and your clients that you know what services might be available for your clients. We don't want anyone missing out that's already vulnerable. So that's why we're happy to come and talk here today. Just there might be some things that you aren't aware of that you think, well, actually my client is entitled to get these services. So hopefully there's some helpful information for you. Thanks, David.
We'll talk about the three services and Veteran Affairs home care as well. There's a Commonwealth Home Support Program, which is based on the entry-level programs, home care packages, HCP program, which is more home care, complex home care, and residential aged care, including residential respite. And I spoke before about the reservation home care, for people who may be eligible for as well. So there are three types of aged care services we'll be talking about today. From there, and we'll just go through accessing. Anthony?
Yeah, and I'd just say with veterans home care, if you do have a client that's a veteran, that should always be your first call to veterans home care, because they can get services out easier and quicker to clients than call My Aged Care. But yeah, if any of your clients are veterans, definitely don't forget about veterans home care.
We'll go through the Commonwealth Home Support Program to start with, CHSP, as we were speaking about. There are a number of services what you can get at home: domestic assistant, personal care, home modification, aids and equipment, meals, nursing, allied health therapy, and respite. And of course, outside your home, you can get social activities, individual and group, centre-based cottage and respite, and transport. And as you probably know, social activities is a large component of the CHSP program with the social isolation. So that is one of the big programs in CHSP. Home care packages at the moment, there's 4 packages. There's level 1 to 4. Level 1 supports people with basic needs, and it goes up on the scale. Level 2 supports people with low level needs, and level 3 goes into more complex and intermediate needs, and level 4 is people with high support needs. So they're the 4 levels for the home care packages from there.
And so we've had a look at the Commonwealth Home Support Program, the CHIS program. So that generally is for someone that might need 1 or 2 bits of help, not complex needs. But if someone needs multiple levels of care, that's when they should be assessed and receive an aged care package. The value of the package is greater at the level 4. That, level 3 and 4, you should generally be getting personal care and assistance. Personal assistance. Level 1 and 2 might be a bit of transport, shopping, maybe cleaning and that type of thing. So the amount of money that you have will determine how many services you can the client can purchase with the value of their services. Thanks, David.
And of course, there's permanent residential care and residential respite care, in a sense like hotel services and to meet your needs and preferences. And of course, in residential care activities, support and entertainment, help with bathing, dressing, toileting, etc., access to health practitioners and client care. So that is in the residential care and respite care.
And generally, people are entering nursing homes, residential aged care, generally when they can no longer stay out in the community by themselves. There's some people that proactively want to get in there, while they're able to make choices. I'm feeling like I'm ready to go in, but a lot of people, it is can be post a fall or a hospital admission or something else like that. So going in, when it's not your choice, unfortunately. But the respite thing is definitely a big thing for people that if they're getting cared for by their family or they just need a short-term stay, they can book in for a week, a month or something of respite care, and that can sometimes help stabilize people or give the carer a break as well sometimes as well.
Now we'll go into how to access aged care services from here, and it can be a little complicated, so we'll take you through the steps. So the gateway to aged care services is My Aged Care, or MAC. Aged care funded services, you'll see this on screen, so you can find My Aged Care or go to myagedcare.com.gov.au and fill out the online assessment form. And some doctors do referrals, not everybody, to My Aged Care as well. So GPs may offer this service, or you can book a face-to-face appointment or video call now with an aged care specialist officer at Services Australia, and they're at example at Salisbury, Modbury, Port Adelaide. And you can look on the website for that. So you'll need to make sure you have your Medicare card ready for this call. If you're calling for someone else, they need to give their consent for you to be the representative. You'll be asked questions to work out your needs and care arrangements and allow at least 10 minutes for these calls. And really importantly, you'll get a unique client record will be created. Write down and keep this registration number. That's really important because sometimes people do lose that number. So that is a really key point. Make sure you keep that client record number from there. So that's the gateway to go through the Australian Government My Aged Care services is My Aged Care.
And we understand that for your clients, they just can't pick up the phone and ring My Aged Care and or use their laptop to go into the My Aged Care online and all this. But this is just for your information so that you understand the basics of the system and how it works. But if anyone wants to receive aged care services other than Veterans Home Care, you must enter via My Aged Care in one of the different methods.
So My Aged Care functions through the contact centre, support clients and their support networks to access information and services, including answering general inquiries, registering clients and representatives to create client records, screening clients' eligibility, issuing referrals for assessment of type of care needs, and coordinating support for vulnerable people until appropriate services are in place. And I think that's what we're talking about today, and requesting support plans for reviews. So that's their role as My Aged Care. We spoke before about aged care services officers. They're sort of a newish thing, been around a couple of years now, and they're at various locations, and there's a number you can call there as well, and they'll check eligibility to government funded services, make a referral for an aged care assessment, help appoint a representative for My Aged Care, which could be someone on this call today, helping out as a case manager, provide financial information about aged care services, connect you to local support services. And as I spoke before, there was Norwood, Marion, Port Adelaide, Modbury and Salisbury. And there's also aged care service officers at regional locations now, like Berry, Ceduna, Kadina, Mount Gambier and Victor Harbour. So they have expanded a little bit too. So there are access to those officers across South Australia.
And they have been around a couple of years now, and look, from what we understand, they're pretty much fully booked out all the time. They're really good for people that, especially that have income and assets. Services Australia are really good in understanding the financial implications of entering aged care. So a lot of people go there to help them with income and assets and that type of thing, but also they can help get someone that may not feel able to phone My Aged Care or do it by themselves. They can actually help get the person through the process as well. So they're a great extra addition that the general public can telephone, make an appointment, and get help through the system. And yeah, they've got locations around metro and country, which is really good now.
We're speaking about representatives before. Anybody who'd like to help by talking to My Aged Care can give consent for another person, trusted person, to act on their behalf. Representatives can speak and act on behalf of others, and clients can still communicate directly with My Aged Care. That's children's or spouse, or in some cases, like case managers, like we're talking about today. Authorised representatives are individuals, and that's the guardian organisation, public advocate, or speak on behalf of an older person who can no longer make decisions for themselves. So that's what representatives cover from there.
And I think for a lot of people that are lucky enough to have spouse or children involved, if people are entering aged care, it's quite common to nominate their children or spouse partner to talk for them if they're not able to confidently phone My Aged Care and deal with them, because it's tiring to have to wait on hold for half an hour and try and talk the lingo that you have to actually talk. So yeah, representatives are another important thing, and like David mentioned, then if someone has an appointed representative, well then that's a different, that's a step up. That's an authorised representative. I'll just mention this one quickly, David. Like, if for the general public out there, a lot of times if the family's doing it, they like to have an online account so you can see everything online. Not when we go out and talk to groups of older people, we say put your hand up if you use a computer a lot or you're active on it. And yeah, we find the older the age group, the less they use computers and IT and that. So you know, this would be no good for my father who doesn't use a computer having an online account, but maybe for me, if I was looking after him, it might be easier for me to do it. So that's another thing. You can have an online account with My Aged Care. Back to you, Dave.
Thank you. And assessing your needs, My Aged Care may arrange for a trained assessor to come to your home. Some assessments also occur by telephone. They'll assess your care needs and eligibility for service. They'll then work with you to develop a support plan, which will address needs, goals and preferences. And you can invite a family or friend to be present when My Aged Care visits. So it can be important to have that support there.
And this is where the initial phone call to My Aged Care is really important, because you know, them asking, are you able to clean your house or do your gardening? Well, the person might say, yeah, I can do it, but they might actually need to lie down for 2 days after because they've hurt themselves every time they do it. So really saying, you know, having a good conversation with My Aged Care at the initial phone call when they do their triage is important, because some people underplay what they need and then end up not getting the appropriate assessment. So it's really important to articulate what help you're needing, what you're struggling with, and all that type of stuff, so that you get an appropriate assessment. And and this is what we say to the general public, it's not about what your neighbour gets, it's about what you need to help you stay at home and safe, and for as long as possible. So what your neighbour gets, don't worry about. It's what do you need to help your life and look after you, because everyone's different. Hopefully people do come out to the house. A lot of things now are done over the phone, because there's lots of the volume of people wanting assessments is quite high, so they do phone assessments as well, and you are entitled to have someone there with you when the assessors come out as well. So I just thought I'd reiterate that part.
Talking about finding about costs now, My Aged Care and service providers can talk to you about cost. Aged care is subsidised by the government, but you're expected to contribute to the costs. Providers and costs are My Aged Care via the service finder, and My Aged Care will tell you if you need a financial statement.
And there are fee waivers, so I'm assuming a lot of your clients may be extremely vulnerable, that, you know, if they're only receiving an age pension or a pension, and that you can obtain fee waivers if that's the case. But if someone's on a, you know, self-funded retirees that sometimes generate lots of income, well, then Services Australia will determine how much you need to contribute to help pay for the cost. But the Commonwealth does, you know, provide the bulk of the funding.
How to find and choose a service. There is a service finder on the My Aged Care website, which may be able to locate and compare available services in the area. And your assessor in My Aged Care can also help you find a service provider in your local area that meets the needs. Being approved for a type of care assessment does not mean an automatic access to service. Service may or may not be available. Use the availability filter on Service Finder, which I think is an important point too. So not automatic access. It can take a little bit of time when you're being approved for a service.
Yeah, that's right. The availability filter is quite important to use, because there might be 60 or 80 providers of a care type in an area, but only 4 or 5 might actually have availability at this time. So that's an important thing. And also, you know, even in the city, it can be hard to access some services. Under the Commonwealth Home Support Program, you know, cleaning and home maintenance, which is gardening and that, it's very difficult to access because there's the demand is greater than what the capacity of the industry is, so that there, you know, you get assessed and then you will receive you know, what you're allocated, but unfortunately sometimes then people have to wait even a bit longer for a service to become available that suits their needs in where they're living at that time.
And we're going to talk more about this shortly as well with the Care Finder program. So if you're not a person require intensive support to interact with My Aged Care or other access community supports and have one or more of the following: has no one to assist, communication barriers are difficult, or processing or past poor experiences, resistance to engage with aged care and your safety is a concern. We'll talk about this shortly. There are, as the Contact Centre, Services Australia, in-person individuals, intensive support, and there's the National Aboriginal Community Control Organisations, My Aged Care Special Officers, Elder Care Support Program. But we'll speak really about how you can access the Care Finder from there, which talks about being homelessness and all other sorts of factors as well. We'll talk about that in a few minutes.
Yeah, thanks, David. So other than the My Aged Care call centre, we've talked about aged care specialist officers. So that's a bit of extra help that people can get if they're struggling. But then more importantly, and why we have Carmela here today, the Care Finder program is really, really important to help people that just can't get into the system or really need intensive support. So that's a great program, and it really helps the most vulnerable. And then also the new elder care support program, which is to help First Nations people enter aged care as well.
And there's also the Carer Gateway as well for people who care, which is an important pathway as well. You can contact them on that number, 1800 422 737. They do phone counselling, connect with the carers, self-guided coaching and skills courses. So it can be really important for carers to connect with the Carer Gateway as well.
Yeah, we often forget about the carer, how much work the carer or caring and effort and time that carers put in, and then carers can fall in a heap and be under stress as well. So we often talk to people that are caring for a loved one to get in contact with the Carer Gateway that can really focus on what you need as well, not just the person needing aged care. So I'll just quickly recap. So aged care, if you want to access Commonwealth funded aged care services, it's all via My Aged Care, online, via the phone. There's lots of information available on that website. There are even YouTube clips on how you can enter aged care and the client journey. So there's a wealth of knowledge out there for people if they need it. And also, like this is just another graphic, but you can, via telephone, My Aged Care, face-to-face with Services Australia, the aged care specialist officers, face-to-face with care finders as well, or you can go via the website, or as David mentioned at the start, some doctors that do notice their clients are getting more frail and need some help actually can do a digital referral to My Aged Care. Then everyone will get an assessment based on their individual needs and then be allocated the whole range of services that are out there, and then hopefully find a service not too long. Now, I'll just mention that the aged care system is changing dramatically on the 1st of July this year. There's a new Aged Care Act coming in. It's rights and client client-based. It's all about the older person and their rights and what they can achieve that's best for them. There are strengthened standards. We've mentioned the Commonwealth Home Support Program that remains, but home care package program will morph into a new support at home program. So yeah, there's some big changes ahead for providers, but for older people out there, the steps are the same. Go through My Aged Care, receive an assessment, and then find a service, hopefully find a service. And if you do have funds, you expected to contribute what you're able to contribute towards the services. Now, will we hand straight over to Carmela to give us a nice in-depth talk about the care finders, or did you want to do questions first? I'm not sure.
No, that's all right. We can continue on with Carmela. Perhaps if people have questions already, pop them either in the chat or the Q&A function, and we can have a chat at the end and address questions at the end. Unless anyone's got anything burning, feel free to sing out. Otherwise, I'll get you to stop sharing your screen there, Anthony, and then Carmela can kick off.
Carmela's already up and about.
Sorry, just getting my mic on there. Okay, so hopefully you can see that presentation there. So thank you for having me today. I'm Carmela from Anglicare, and we'll be just delving a little bit deeper for a few moments into the Care Finders program, which, as has already been mentioned, really helps the more vulnerable people. It helps people with limited or no family or support network to access aged care and other services, and just to help them navigate the system. So it's particularly around the eligibility, we're looking at supporting those that need assistance to understand information or make decisions. So that might be around changes with their cognition, for example, or people who have language or other communication barriers, a hesitancy to engage with services, or a current experience of homelessness or housing insecurity. So it's for people who have one of those factors, plus limited or no support network, and that meet the age criteria. So the age criteria generally is for people aged 65 years or more, or 50 plus for First Nations people. The exception there is when people are experiencing homelessness or housing insecurity, the age criteria drops down. So in those cases, we can support people who are aged 50 years or above, or 45 plus if it is a First Nations person. So the sorts of ways that care finders can go about helping with navigation of those aged care services can be meeting face to face, so meeting in person, having those in-depth conversations around what a person's needing, and helping them to understand what services are available, like those that were discussed in the earlier presentation, and to help go through those steps with accessing My Aged Care. So care finders can speak to My Aged Care together with and on the behalf of the individual with their consent to help get that process underway if that's needed. They can also help connect with other community-based services, so it doesn't purely need to be just around aged care services. There's a lot of work done, for example, in the housing space, but it can be in other community-based services as well. Care finders can help complete paperwork, relevant forms that can be a bit overwhelming at times for people, or that they're just not able to manage that without some support. And care finders also check in regularly just to make sure things are progressing with accessing the supports that the person needs, particularly because of their vulnerabilities. So the care finders are involved short-term or medium-term generally. So this might be days, might be weeks, it may be months if it's a more complex situation. So it's really tailored around what that person needs and how quickly we can link them into all the supports that they require. And from there, they would then have a case manager or other services that can support that person on their journey because they're already linked into that support. So it's really a collaborative and a connection sort of role, I guess. So just to demonstrate how it might look, I've got a bit of a case example here. So there was a 52-year-old male who'd been homeless for around 20 years, and he had experienced concerns with his mental health as well as having previous drug and alcohol use. He hadn't seen a medical professional for quite some years, but we had learned that he had diabetes, which wasn't managed well, and other medical conditions. And as we got to know him more, learnt that he was at risk of a leg amputation. So the care finder was involved for a while in this case to build trust with the person, and they worked together and achieved the following outcomes. So there was linkage with a financial counsellor regarding debts and accessing emergency assistance, particularly around food and food vouchers for the immediate need there with nutrition, which is of course very important with diabetes. There was some advocacy work done around housing, and this customer was accepted for Category 1 housing and later was able to access long-term housing. The care finder helped to make sure that home was set up with everything that was required for day-to-day living, the white goods, bedding to keep warm, the furniture. And from a medical perspective, the person was connected up with a GP and mental health services. In addition, he was connected with an NDIS advocate who was able to help him to access mobility equipment as well as some care services. So in this case, it was through NDIS because of his age, but quite often we support people into my aged care or aged care services. So how do you access the care finder? There's quite a number of organisations that offer this support, and Anglicare, where I'm from, is just one of those. So the organisations listed here on the screen are for the Adelaide metro area, and you can see the specific council areas for each organisation alongside their name. But on the bottom left, you'll also see a website through My Aged Care where you can actually find anywhere in Australia which care finder organisations can assist. So that includes rural and remote areas. So to make contact, you can either phone or email the care finder organisation directly. So some of those might have a specialty in a particular area like housing, and others, like Anglicare would be more generalist, so we would cover housing or aged care, as would most care finder organisations there. So that's care finders in a nutshell. I might just stop sharing my screen and hand back to Sam, unless anyone else would like to add further comment around the care finders program.
I'd just like to say that all the care finders in South Australia, they really, from what I can see and hear, do a great job just helping the most vulnerable people that otherwise always fall through the cracks or would end up in much worse situations. So, I've put the link in the chat there, but you can break it down by state, either Adelaide and country, if you're in the My Aged Care website, and search for an appropriate, provider based on what they specialise in and, where they're located and what they specialise in. So, I've only heard, really good reports about the care finder. I just, I think sometimes, Carmela, there'd be more clients than you can handle sometimes.
The demand is quite high, but we're certainly happy to help.
Great. Thank you so
Thank
much,
you.
everyone. That's all super useful information. So I have a question from Olivia who's asked, can a person access aged care if they have an NDIS plan or engaged with CTG? And I apologise, Olivia, I'm not sure about that acronym.
Sorry, closing the gap if they're being
Closing the
supported
gap.
with, yeah, beg your pardon, sorry.
No, that's okay. My bad.
I don't believe you can receive aged care services and NDIS at the same time.
Right.
So that's a really short answer to that. And generally, NDIS supports would anecdotally be of a higher nature than you get through the aged care sector anyway.
Yeah.
I think where people can no longer live in the community and need to enter aged care, a residential aged care facility, that's where people would generally exit NDIS or most of NDIS and move into the aged care system.
Okay. Excellent. Hong's just asked if we can distribute copies of the presentations for today, the slide presentations. Is that possible? Or, yeah, certainly for Carmela. We might have to check. No, that's fine for, yep, excellent. So yeah, we can certainly distribute that to people who have attended. As I mentioned too, we've recorded today's session, so we will upload it as well and promote the link. So if you've got colleagues that couldn't join today or anyone that you think would be really interested in attending today but couldn't make it on today, then you'll be able to share that and people can watch it at a later date. And I think it was really valuable. I feel like the aged care system is one of those systems that we feel a little bit overwhelmed by at times, and you hear all sorts of anecdotal scary stories. So to sort of have it laid out as, this is how the system is structured and these are the entry points, I think is really useful. And to know about the Care Finder program, I think for many of our clients is fantastic, even though, the demand is probably a bit high, and it's probably, we're no stranger to excessive demand in the drug and alcohol service, that's for sure. And we're pretty adept at supporting our clients the best they can while we're waiting for services. So we understand that, but just to know about the Care Finder service and that's available to support our clients, our more vulnerable clients, I think is super useful to know.
Yeah, and Sam, I would think that most clients of SANDAS organisations, I'd venture to say, would be eligible for the Care Finder program just by the nature of the organisations dealing with them. So that probably would be a first good port of call for your clients. Everyone will be different. Maybe you could be the representative for a client and just help them get into some aged care services, and that might work well. But perhaps for the more complex ones, the care finders might be needed to help get the real complex ones through. But we don't want people not accessing aged care services if they can help them out.
Yeah, that's excellent. That was actually a question that I had when you spoke about My Aged Care doing assessments with people either in the home or on the phone, and that they're eligible to have a person there, whether that has to be a family member or can that be a care, a case manager or a support worker, or is that a role that that the Care Finder program can fulfill as well? Because having a person there along when that assessment happens, I think is almost essential in most cases.
Yeah, it's a person that is chosen by the client being assessed.
Okay.
So they could have their neighbour, their close family, or just a trusted friend.
Okay. Yeah. Excellent.
And it can be a care finder too. Yeah.
Great.
There is a
Fantastic.
brochure around care finders, so perhaps I'll share the brochure with you as well that can be distributed.
That's great. Yeah, we'll definitely share that. That would be excellent.
And I just put the brochure, Find the Help You Need with My Aged Care. It's the basic one that was that brochure from the My Aged Care is pretty much what our presentation was as well. So I'll put the link in there.
Fantastic. Excellent. Tom's just mentioned that was really helpful. Thank you. Anyone else got any questions before I let everyone get along with their day? No, nothing burning, nothing coming up on the chat. Great. Excellent. Well, thank you for attending today, and thank you very much to our speakers. Thank you to David, Anthony and Carmela for your time today. We really appreciate you coming along and being willing to answer some questions and share that information with us. I think it's really helpful. And I know that we've talked in discussions between us and with Angelina about building an ongoing relationship and partnership between drug and alcohol and aged care to keep these discussions going about making sure that there's equity of access for our client group to aged care as well. So I look forward to working with you all more. And yes, thank you everyone for attending today, and I wish you a good week. We have one more seminar left in this series. It's happening next Tuesday, and I am your guest speaker talking about the National Minimum Data Set and data collection, which is a super exciting topic, but if you're an organisation who's required to collect that data as part of your treatment services, you might appreciate the refresher, or if you've got new staff in your organisations who are keen to learn about their NMDS and making sure that we get as much consistent data as we can, then that will be a good one to attend. So look out for those links on our e-news bulletins, and we'd love to see you next week. And again, thank you to our speakers and thank you to everyone for attending.
Thank you.
Thank you.
Thanks very much.